Hi Nurse Fam, this is Nurse Kitu. I am here with another video. I thought it would be really important because of the time that we're living in. We are currently in a pandemic due to the coronavirus, or also known as COVID-19. I thought it would be interesting to talk about COVID-19. And what my role is as right now as I'm working with my local health department in doing contact tracing. So a lot of people don't even know what contact tracing is. And so what is coronavirus, okay? Coronavirus has been a long time, but COVID-19 is a specific virus that has been identified. It is the family of the SARS virus. And unfortunately, COVID-19 has spread out throughout the world. And that's why now we are, in a pandemic. And so COVID-19 can spread from person to person. And there's a lot of symptoms that the CDC has identified as, having symptoms of COVID-19, such as a fever, anything 100.4 or higher, a dry or a productive cough, shortness of breath or dyspnea, sore throat, chills, runny nose, muscle aches. I've heard a lot of patients complain of back pain, headache, nausea, vomiting, abdominal pain, diarrhea, or people losing their sense of smell or taste. That's a very common sign and symptom of COVID-19. So again, how do we protect ourselves? CDC has, gone back and forth with the mask, but, we are seeing worldwide that it's important to protect ourselves by wearing a mask, like a cloth mask. I have a cloth mask that I wear out at work or in the public, but if I'm testing for COVID-19, then I use a different type of mask called the N95 mask, which has, a special filter. And the reason why it's called an N95 is that it filters out 95, it filters out about 95% of different viruses. And so that's the mask that providers will wear in the acute care setting, like the hospital, or if you're, working at a drive-through test site, that's the mask that providers should wear. And we know in the beginning of the virus, there was a shortage of N95 masks. So definitely the way to protect ourselves, since there's no vaccine currently right now, is to wear a mask to help the prevention of, transmitting the disease to another person. Staying home as much as possible, only going out for essential things like, if you have to go to the pharmacy, if you have to go to the doctor, if you have to go to work, and then come back home. I know in different states, they have different phases. Like in Florida, I believe we're in phase 2 right now. People are starting to go out again and go back to their normal routine. Interestingly enough, we're starting to see a rise of cases in Florida. So again, it's so important. Number one thing to help prevent transmission of any disease is hand washing, good hand washing, at least 20 seconds. If you don't have access to soap and water, then using hand sanitizer. Practicing social distancing, which means, staying at least 6 feet away from the next person and not touching different things. The mask also helps you to prevent touching your face. Unfortunately, everybody is at risk for getting COVID-19. So those that have underlying conditions, the CDC is looking at specifically if you are a current or former smoker, diabetes, chronic lung conditions such as asthma, COPD, any chronic kidney conditions, chronic liver disease like hepatitis, cirrhosis, cardiac disease, high blood pressure or hypertension, any history of neurological disorders or neurodevelopmental disorders. If you're immunocompromised, these are the underlying health conditions when we're reporting off cases to the CDC that they are looking at. But everybody is at risk for COVID-19, even young children and babies. We've seen pregnant mommies deliver babies that are that have COVID-19. And so older adults, of course, because they may have a weaker immune system, they are also at risk for severe illness if they already have other conditions as well. So again, to prevent the spread of the disease, try to stay home as much as possible. And if you're exhibiting any signs and symptoms, you want to make sure that you isolate yourself from other individuals in your household. Like if you can stay home, not stay home, but stay in your own room. Don't share utensils. And all of this information is from the CDC website. That's what I'm looking at here for my notes. Now, a little bit more about contact tracing, not contract, but contact tracing is a way that we help to contain disease when you're looking at the study of epidemiology. So, public health workers like myself, we will contact those that are positive, do a interview with them, asking them what their signs and symptoms are, educating them to stay home and to isolate themselves from, different members of their family, making sure that they don't go to work. And so contact tracers are needed if you have lost your job. It's important for you to, you can look online. You can go to Indeed.com, look up contact tracer. They will train you, and you would be able to, I think the lowest degree that you need is a high school diploma, and they will train you on how to conduct the interviews or the epi investigations and how to do contact tracing and trying to contain this this disease, this virus. And so if you're looking for work, you can work from home. Like I said, you can go to Indeed.com, put in contact tracer or epi investigations, and for the location, you can put remote. And so if you're looking for work, this is something that you can do from home. Not all companies want you to work from home. They may want you to come into the office, but I personally would want to work from home because of the cases in my locality or my area is increasing. So I think it's best for people to stay home, but that's my personal opinion. I know other people disagree, but this is my channel and I get to say what my personal opinion is. So that's a little bit about contact tracing and COVID-19. And, again, it's important. If you forget everything I said, make sure you wear your mask, make sure you wash your hands, make sure you practice social distancing. And, that's pretty much it. I hope this was helpful. This is, like I said, information you could look up yourself through the CDC, Center for Disease Control, located in Georgia in Atlanta. And please leave your comments, suggestions. What do you think my next video should be about? And I look forward to reading your comments so that way I can grow my my YouTube channel. So please don't forget to hit like, subscribe, and hit the notification bell so you can see when I have new videos come out. All right, bye.